Welcome to the Healthcare Executive Podcast, providing you with insightful commentary and developments in the world of healthcare leadership. To learn more, visit ache.org. And without further ado, your host.
Hello again, everyone, and welcome to the Healthcare Executive Podcast. Our guest today is Dr. Gary Guthart. He is the CEO and member of the Board of Directors of Intuitive. We are proud to have Intuitive as an ACHE Premier Corporate Partner. Our Premier Corporate Partners play a vital role in supporting ACHE's vision and mission to advance healthcare leadership excellence. Now, Gary held his current role since 2010. He joined Intuitive as part of the first engineering team back in 1996 as a control systems analyst. He was promoted to Vice President of Engineering in 1999 and Senior Vice President of Product Operations in 2002. In 2006, he was appointed President and COO. Now, before joining Intuitive, Gary was part of the core team developing foundational technology for computer-enhanced surgery at SRI International, formerly Stanford Research Institute, a renowned nonprofit scientific research organization. And while at SRI, he also developed algorithms for vibration and acoustic control of large-scale systems. His first scientific experience came early in his career in a human factors lab at NASA, supporting a team studying human performance assessment of pilots. Gary received a Bachelor of Science in Engineering from the University of California, Berkeley. He earned a Master of Science and a PhD in Engineering Science from the California Institute of Technology. With that introduction, Gary, welcome to the Healthcare Executive Podcast.
Eric, thanks for having me. I'm delighted to be here.
All right, let's jump right in on Intuitive. Tell us a little about the starting point there. Tell us the Intuitive story.
Yeah, I'm going to start with the patient perspective, and I'm going to work my way back into Intuitive. What are patients looking for? And all of us are patients in our non-professional lives. They want to be healthy. If they do have a disease, they want it to be diagnosed quickly and accurately. And if there's an intervention required, for that intervention to be done right the first time and allow them to get back to their normal lives quickly. Intuitive is a company that lives at the intersection of technology and healthcare. We're not a healthcare provider. Our customers are. Our clients are. And so our job is to help healthcare providers provide that experience for patients. And you look out and you say, for those of us who are close to the space, who have lived in the space for a long time, and you heard my background, it's a pretty data analytic. If you start looking at the data, you realize we're a long way from there. So what does Intuitive do? We look out and try to marry a deep clinical understanding of what patients need in an acute care environment. And then we provide for our customers a technology-enabled ecosystem to allow them to provide a great intervention experience for their patients across a population of patients and a population of care teams. We develop our products for use by professional physicians in professional environments. We're not a company that creates technologies for hospital at home, and we don't go direct to patients. We work in service of providers and their mission.
Well, perfect audience listening, healthcare leaders listening to this podcast. Let's talk. Is there a paradigm shift, would you call it, related to minimally invasive acute care that you're trying to change here? And if so, can you describe that change?
Yeah, I'll start again with data. If you look out at outcomes for surgery, let's just choose surgery, you find that it's highly variable. It's variable by patient population, and it's variable by care team, surgeon and care team populations. And what we're trying to do is really raise the median, raise the median and the average, such that a large section of population are getting the best available outcomes, and more care teams can deliver those great outcomes. And so can we help create that change? I think the evidence is we have. If you look at something like a minimally invasive prostatectomy, removal of a cancerous prostate, Intuitive's history is that was largely an open surgical procedure, had a long recovery time, a lot of blood loss, a fair amount of positive surgical margin or cancer left behind 2 decades ago. In the intervening 2 decades, it's converted to, in the United States and in many countries, a majority minimally invasive approach. Complication rates have come way down. The length of stay in hospital has come way down. And the total cost to treat those patients, I'm sure we're going to talk about economics later, total cost to treat has also come down. So it's kind of been a win-win-win. It's a win for the patients It's a win for the healthcare providers, and it's lower total cost of care. And so when that's happened, we've seen the market, we've seen the practice shift and create a new standard. So we do think there's opportunity there, and that's just one example.
And so let's dive into a little bit about those costs and those values. And you were just talking about procedures specifically. So let's talk about the value of robotic assisted surgery over, as you were just describing, the open surgery or laparoscopic surgery, and then the various factors that will impact and affect the cost of care here.
Yeah, I think cost of care is important, and all of us, I think, living in the space know it. I'm going to start with the quadruple aim. I think the quadruple aim, as articulated by all of you listening, has been what are we trying to achieve? Better patient outcomes, better experiences for patients, patient experience, better experiences for the care teams that have to deliver that, and lower total cost to treat per patient episode. So what is the total cost to treat, and how do we look at that? And it turns out you can do it, and it has to be done carefully. So often folks think about the cost as just the direct cost, just the cost of the knife, the cost of the scalp. But the reality is that most of the costs of going to treating a patient are the cost of paying all the salaries of all the people who have to deliver that care. The cost of the material is actually one of the smaller costs. It's the total cost of that experience. And if somebody has to come back to the hospital 4 different times, if they're in the ICU for 2 days, if they need to be rounded on for another 2 days thereafter, that's where the dominant costs are. So a careful cost accounting is really important. What we found is that if you can improve outcomes across the population, you can save costs. You can save direct labor costs. You can save the costs of additional medications. You can move out of very high or very expensive care environments into lower expense care environments, whether it's out of ICU and post care, or whether it's moving from inpatient care to outpatient care. Those things can be driven with better outcomes, more repeatable outcomes across a broad population with patients and surgeons. We now have enormous amount of real world evidence from all of you through data sharing agreements that have demonstrated, not in academic studies or theoretical studies, but in addition to that, in your own hands with your own economic data, that indeed a better surgery and robotic assisted surgery is in fact often the lowest total cost to treat method relative to open surgery and laparoscopy. And why is that? It's not because of the cost of the scalpel. It's because more consistent outcomes across a larger patient population lowers costs. And you don't have to believe me. You can actually look at your electronic medical record data and see it in the data.
Well, Gary, we're so happy to have you on this podcast because one of the things we talk about a lot is access to care. And so it's well documented that social factors such as income, zip code, housing directly affect access to surgery and those surgical outcomes you were just talking about. So how can Intuitive help improve access to the best forms of care, best procedures?
Yeah, it is a really important topic and one that we have some passion for. I think maybe think about it in 2 or 3 different legs. And I think the first one is, do patients, are they aware of and do they have access to best types of care? Are they being offered the right kind of care? And do they know to ask? So some of that is where are great programs running, and what is their outreach capability, and what do the diagnostic pipelines look like? So that's one section. The next one is, are teams trained? Do we have teams trained well enough so that a patient walking in the door is not offered what's convenient for the care team, which is an uncomfortable truth in healthcare today, but are instead being offered choices that are best for them, not based on what the care team knows, but what is best for that patient at their particular history. And so that next thing here is around ubiquity. Are we in the right places, in the right neighborhood, and are enough people trained to give the best outcomes? That may not always be robotic assisted surgery. I'm not claiming that the best thing in every case, in every setting is what Intuitive offers. I'm only stating that it's important to say, hey, it's patient centric. They have access to. And then the last thing are things like coverage. Is insurance coverage available and adequate, such that if they know about it, if they're offered the rights, then is it important to them? I think we got to work on all 3 of those. Well, that's something that Intuitive is doing. And we're a data-driven organization. So we start with, let's look at any deficits in those 3 things. Are there deficits in diagnostic pipelines or education? Are there deficits in the availability for people to offer the care that is appropriate for that set of patients? And are there deficits in coverage? And to the extent that Intuitive can help with gaps in those three, we will. And by the way, we do it not on our own, but in partnership with our customers. We reach out and say, how do we help each other in this space? Because what's happening in, for example, the eastern part of California may be different than the needs in West Texas, may be different than the needs Panhandle of Florida. And so rather than us having a one idea that fits all of it, it's to sit down with our customers who are intimate with these issues and work through it together. I'm quite optimistic that we can make a change over time.
Well, let me ask you about that. So where does that optimism come from? Why are you so optimistic? And then, what drives you? What keeps you inspired day in and day out with the work you're doing?
Yeah, I'll start to the issue of can we improve outcomes? I think unequivocally the answer to that is yes, and it's not spreadsheet math to me. These are surgeons in hospitals, hospital administration, and patients, people we talk to on a day-to-day basis that see the powerful changes that great outcomes and standardization on well-developed techniques can bring. There's a fair amount of data out there, and it's not Intuitive sponsored data, and it's in high-impact journals that say the variation in surgical outcome as a function of care team skill is a factor of kind of 2 in the relative success of the procedure. In other words, the likelihood that a low-performing care team generates a complication is about 2x a high-performing care team as defined by quartiles. And that's, as I said, it's not Intuitive data. It's been out there. It's kind of shocking, actually, 2 to 1. And so the question is, can better data, better training, fully connected care ecosystems, can they narrow that gap? And the evidence is that indeed they can. So I think that's fantastic. I think we've seen it. And we see that when you can do that and satisfy quad A, so it's not just better outcomes, but better for the care teams and better for the economics, that you see adoption. So that's powerful. What keeps me motivated personally? My own family, we've been through 5 cancer surgeries, probably another 3 or 4 surgeries that were non-cancer, diagnostic odysseys and journeys. And these are by well-intended, incredible care teams working at great institutions. I don't harbor an inch of ill will towards the people who are trying to care for our family members. And yet it's incredibly difficult. We have decades of work to do. And for those of us who are close to it, who see it every single day, the effort, the strain that the care teams do to deliver this and the variability of outcome, I just think there's nothing better to work on. We have seen if we can bring the world's best technologies together with the world's most competent and motivated human beings, human capital, we can make a positive change. That motivates me plenty.
Well, we appreciate you sharing that story and sharing your optimism and rallying us too in this moment. You've been listening to Dr. Gary Guthart. We thank Intuitive for their support as an ACHE Premier corporate partner. Gary, thank you so much for joining us today.
Eric, a pleasure to talk to you today. Thanks so much.
And we thank you for listening. As always, we will catch you next time right here on the Healthcare Executive Podcast from ACHE.
This has been the Healthcare Executive Podcast, brought to you by the American College of Healthcare Executives. If you've enjoyed the show, please consider rating and reviewing on iTunes or your podcasting app of choice. And for more information, find us online at ache.org.